what would you say to him? You certainly wouldn't.
Well, they say that the government's supposed to give, like, if you cut a certain amount of cost, they're supposed to give you, like, a percentage of it back. That's what Kemal told us.
Well, elaborate that. Actually, you're on the right thing. So,
Okay, keep going. Don't take this from him.
no, that's the point. That
So basically, like, if you cut your costs in half, then the government will give you, like, probably more of it back. Like, they'll probably give you what you missed and probably a little bit more back to, like, incentivize you to keep cutting the costs and continue with it.
Well, where is that going to come from,
The government. The government's
well,
money.
when we are cutting the cost, I think we need to kind of specify that whose cost we are cutting. Right? We are cutting the cost for the insurance company, in this case maybe for the government, because it's Medicare and Medicaid. So that's your part to get some incentive from it, because your cost will actually increase to, perhaps it will, perhaps not, but it may increase, your practice cost may increase. So I think there's a little maybe confusion there. So cutting the cost is not necessarily for this practice, but you are cutting the cost of the treatment. Who pays for it is the insurance company. So that's how you are going to utilize the money. Is that right?
Right, and also they have a very kind-hearted approach. They want to cut cancer. They want to cut pain and suffering. And I think, you know, when you were talking about how difficult debating is, it's hard to come back to a comment that says, well, I just don't think this will work because you're going to lose money.
Mm-hmm. So if you were to show some numbers, like, you know, they saved $100 million over 10 years, for them to give 10 million of that back to the practice to help pay for some of the money they put in, they're still saving 90 million, and 10 million to that practice is, you know, maybe more than enough. So if you could, you know, just in the future elaborate, could you talk about number of patients they're seeing, what is the average costs of different procedures and the different tests?
It's a great concept.
Mm-hmm.
Well, I think you guys did good. There are all these questions and the comments is going to make this more complete. I think we have to do that. Now, I think the point that you have, the relationship between the whole reason for the presentation or for the group project is we have the pilot project that takes something already in place, and then we are changing the way we practice to get something else out of it. That something else is going to be the cutting the cost, and then cutting the cost for who pays for it. So I don't pay necessarily, I'm the cost. As the practice, I'm the cost to the system. So I'm cutting the cost for the system. In this case, again, that's the insurance company. So if I'm doing that, I need to show that relationship. So I think it started with him and with the questions that comes to that center, so that we have to be able to see that very clearly. So I think you guys did some of the numbers still questionable, but we went through those, which is fine. But the concept, the whole presentation it was about understanding the practice, giving the feedback about the background of the practice, giving the different treatments options, and then what do you do differently. Now, if you have to go back to the pilot project again, let's see. Yeah. So, well, your first one is you want to be more personable, right? The second one is you are expediting the scheduling, I guess. Is that, yeah? And then go ahead. And then you have the gift card concept for incentivizing those patients to come back for their visits. They have access to the seminars, so that's more on the education. Now, we talk about this, patients or insurance companies will not be billed for surgeries surgery, admissions, or follow-ups if specific complications are within 10 days. Individualizing treatment specifically to the patients, clinical trial. There's a little bit. I would probably you'll get in trouble with that. We talked about that in the class a little bit. I think you change it a little bit, but I think there's still some issue there. So, and then do we have any others? So we have 5, 6, 7. So that's a 24/7, and then 8. So you have 8 elements of the pilot study, right? So to make it easier on the background, maybe in the beginning, maybe we should just indicate, okay, we have this pilot project with 8 elements, and then after that you can give the background and then the flow, and then at the end of it you're explaining how it is. But main part of this is going to be showing the relationship between the new treatment or these 8 different elements that you have, and how this helps you to cut the cost. I think that's what they want to see at the end of the presentation. That's what we should be able to. We are selling this basically. Remember the Medicaid meeting we talked about? So we are selling them something. We are making them believe. We are trying to make them believe in what we have, that actually is going to help them in a different way. So now, with these, I still want to see those updates on the final. Before you email me, I want to make sure that you go through those, make those adjustments and changes, and then send it to me all together. But overall, you guys did a good job. Thank you.